Hello, and welcome to the United Nations Association of Sacramento Chapter's discussion on the discrimination in healthcare towards Black women in Sacramento. I am Sadie Luke, the Sacramento Chapter's Vice President and Advocacy Chair. UNA Sacramento focuses on localizing the UN's Sustainable Development Goals. For the month of March, we are specifically focused on Sustainable Development Goal 5, Gender Equality. Ending discrimination towards women is prudent for gender equality. The COVID-19 pandemic has brought to our attention the life-threatening discrimination women face in all aspects of healthcare, Black women being the most at risk. UNA Sacramento wants to understand this deadly issue locally here in Sacramento and globally, and how to address it locally, because I myself and many members of our community understand how dangerous this issue can be. So today we have three amazing speakers to educate us on this topic. But before we begin, I would like to thank the sponsors for today's event: California Now, Green Academy, and Soroptimist. Sorry if I mispronounced that. So today we will be educated on this topic by, first of all, we will have Dr. Shakanda Rogers, a licensed clinical psychologist practicing here in Sacramento. Then we will hear from Asantewaa, and an emergency RN and founding member of Capital City Black Nurses Association and co-founder of ATPT, the Anti-Police Terror Project. After her presentation, we will hear from Adia, Gipson, a lactation consultant and health educator too, and co-founder of Golden Journey Empowerment. Before Dr. Roger begins, I would like to just encourage the audience and participants to add any and all of their questions to the chat, because after the presentations, we will have time to hear answers directly from the speakers. So please, Dr. Rogers.
Thank you, Sadie, so much for the introduction, and thank you all for being here. It's an honor to present and have a discussion about this very, very meaningful topic. So I'll just introduce myself a little bit. My name is Shakanda Rogers. I am a clinical psychologist practicing in Sacramento. I'm in private practice, and I'm really delighted to be here tonight on this forum to talk about a very necessary topic. Question for you, Sadie. Am I able to share my screen? Because I have a few slides I'd like to offer. Okay, great. Okay, here we go. Okay, so tonight I'll be talking about the topic of anti-Blackness in mental health care. Before we delve into a challenging topic of this nature, I always like to just start with something that's kind of uplifting and inspirational. So I just want to start with a poem that that's been offered by Nakia Phoenix, who's the founder of Black Girl Beautiful. You may know her face from the 23andMe commercial. So I want to start with that. And this is a mural that she designed and is present in, I think it's in Atlanta. So lots of Black and brown women go and pose in front of this mural. It's just such an affirming message that we don't often hear for Black and brown women. So, and this is her poem. We have spent so much time thinking about what we lack instead of focusing our energy on what we are. Black is not the absence of color or light. It is not the negative. It is not emptiness. Black is abundance. It is the soul of what we honor and the heart of all we cherish, because Black is us and we are love. So just thought it would be nice to start with that sentiment going forward. So I want to begin by talking about scientific racism being at the heart of anti-Blackness. And this comes from a guide on anti-Blackness in healthcare by Babe Kawai-Bogue. And so she talks about the following. She says, behavioral health care as a field was fully operational in the 19th century, and it supported the systemic oppression of Black people through a single mental illness diagnosis, which was, this was new to me when I learned about it. So I wanted to bring it here for discussion. In 1851, a physician named Samuel A. Cartwright coined the term drapetomania, a conjectured mental illness that caused African slaves to try to flee slavery. If you think about that, the notion of enslaved African people wanting freedom and liberation being classified as a mental illness, this is the beginning of anti-Blackness, discrimination, marginalization, invalidation, all of those things when it comes to Black people as it relates to how we've been viewed by the system. Drapetomania became a credible mental illness in the southern region of the United States, harming the physical and psychological consciousness of Black communities and potentially impacting their intergenerational migration post-Reconstruction era. So this is, sort of the foundation of, ways of classifying Black people very, very early on. And we'll talk about how this has sort of unfolded over the centuries. So what are the effects of race-based trauma? This is not something that just impacts people in one particular area of life. Unfortunately, it is pervasive and can show up in many different areas of functioning. So psychologically, the effects of race-based trauma can show up as depression, anxiety, anger and rage, post-traumatic stress disorder, can be the root of substance abuse, fatigue, dissociation, withdrawal, hypervigilance, which just means being hyper alert to the possibility of threat. It can impact us cognitively, right? It can affect our ability to concentrate, to remember, to focus. It can impact us physically as well, with somatic complaints, injury, infection, hypertension, diabetes, cardiovascular disease, you name it, asthma, respiratory system failure. We've been disproportionately affected by COVID-19. I think that's been, laid bare in this last year, birthing complications and premature deaths. So it can have isolated effects in the moment when we experience race-based trauma, but over prolonged periods, it can have these longer lasting effects, and these kinds of things can get passed down through the generations. And societal effects: diminished access to economic resources, educational resources, medical resources, and political resources because of marginalization and being disenfranchised. And so I'll talk briefly about the allostatic load for Black women. And the easiest way to describe the allostatic load is the idea of weathering. So this just talks about the ways in which stress, trauma, overwhelm that is race-based can have a weathering effect on our well-being, whether it's our psychological well-being, whether it's our health, and just our overall sense of being able to maneuver through life in a way that is unimpacted by these kinds of stressors. And so this quote comes from Shaniqua Walker Barnes, who is the author of Too Heavy a Yoke. She says this, given their race, gender, and disproportionate poverty, it is reasonable to expect that African American women would have higher rates of distress than Black men or white women. Indeed, African American women disproportionately experience a number of stressful conditions and events that are linked to the development of wellness-related problems. They also experience greater morbidity from stress and stress-related illness, for example, coronary heart disease, cardiovascular disease, diabetes, and hypertension than do white women. So this talks about the ways in which the number of stressors that we face and the stressors that are race-based can literally be a matter of life and death, right? Like, that's not hyperbole. It's a real fact and a real state of affairs that we have to contend with, which is why I think having conversations like this, it's so incredibly important. So I'm, again, grateful to be here. And so how do the disparities manifest? They show up in a variety of ways, and I'll just highlight three. First, there's the lack of access to care, whether it's medical care, psychological care. You know, I'm especially thinking about COVID-19 and the impact that has had on our communities, right? And so what happens for people that are uninsured? Right? Can they get access to the type of care they need? And what happens to folks who are underinsured? Can they also access the kind of care they need? You know, I'm just speaking as from my perspective as a clinician in private practice. Mental health care is not it's not inexpensive, and sometimes costs can be really prohibitive, which can create more strain for people who might need the services. And just thinking about, I'll use Medi-Cal, for example. I'm thinking about reimbursement rates for insurances, and Medi-Cal has a really low reimbursement rate for clinicians, which makes some clinicians choose not to be on Medi-Cal panels because the reimbursement rate is so low. But then if you are not on those panels, then the people that may really need the services may not be able to get access to the providers that that might look like them or might provide the care that they need, which leads me into the second pillar here. So lack of diversity in providers. Unfortunately, there's not a great representation of diverse providers in this field, although it is growing, and that can create a lot of mistrust for people who are looking for providers that look like them and might not be able to get access to them, right? And so does that then lead to people having mistrust of providers who are caring for them if they don't share the same cultural background or have the same kinds of cultural sensitivities? And also just thinking about factors as it relates to training. Sometimes getting a higher level of education requires more money, right? And that can be prohibitive for people who might be seeking out training in order to be able to provide support to communities that need it. And so, you know, there are multiple layers here that create these barriers to care. And then there's the stereotypes and or ignoring cultural factors when it shows up in therapy. So, you know, I think, you know, if I go into a therapy setting and I have a clinician who either sees me through the lens of stereotypes, that might make them misdiagnose me, right? Because they're seeing me in a way that's inaccurate. Or conversely, if the clinician that I'm seeing ignores cultural factors as it relates to the distress that I'm presenting with, then that really leads to missed opportunities for intervention, which can lead to poor treatment and poor treatment outcomes. And then it reinforces the mistrust that that people may have. So it can be sort of like a feedback loop that it's hard to get out of. But I think I've got some ideas on how we can intervene in this cycle. So what would help? Improving geographic access. So, having clinicians of color in communities of color so that people who need the services can access the services with clinicians that look like them. Offering funding for treatment, right? So being able to have adequate funding for providers, adequate funding for programming, I think would be incredibly helpful. But as we know, when budgets are cut, usually the first cuts are usually to education and mental health, unfortunately. Partnering mental health with primary care, right? That might be a way of being able to help folks who are seeing their primary care physician, being able to partner with them. That might help, route people to the mental health services that they need. So more continuity of care between primary care and mental health care. As I mentioned before, increased representation of diversity in providers. It's incredibly important. The other thing is the negative stigma that's attached to seeking mental health treatment, right? Sometimes people have a lot of shame around that. People, may face discrimination. They may have mistrust of the mental health care system. And then also, conversely, reducing the societal barriers to the training that I spoke about. The other thing that I think is really important that we don't talk a lot about is assessing for race-based trauma. There have been more conversations recently about the adverse childhood experiences questionnaire that people are using in assessing whether or not people have had trauma early on. But I think it's also important to assess for race-based trauma historically and presently, right? So finding out how much of someone's current level of distress is related to any race-based trauma they might be experiencing right now. And of course, providing culturally competent care so that people feel seen and heard and validated and understood, and people are given space, right, to bring in parts of their culture and their background that are really relevant for them, because that can also be a tool for healing. And then also creating those safe spaces to heal racial trauma. I can't say enough about that. That's incredibly important, especially in light of the racial unrest that we've had in this last year. I think these kinds of spaces are really, really crucial for well-being. And so I'll talk just briefly about liberation psychology. So liberation psychology is a little different from Western notions of healing and wellness and understanding people's functioning and what will help improve their quality of life. And so Dr. Tama Bryant Davis, who is a psychologist based at Pepperdine, she talks about it in this way, which I thought was really clear and direct, and shows the distinctions between the way all of these things might show up if a client shows up in my office, for example. So for someone who's suffering, society might ask, what's wrong with you? Trauma-informed practitioners ask, so these are people who are rooted in understanding how trauma impacts our current level of functioning. They might ask, instead of what's wrong with you, what happened to you? Now, folks who are culturally aware, trauma-informed practitioners, they might ask this question: what happened to you and your people, and what continues to happen? Right? That's a really big distinction, right? So it's not just what has happened to you individually, but as a culture, as a people, where has harm been inflicted and how does that impact your functioning? And further, folks who are trained in liberation psychology, so liberation healing informed practitioners might ask the following: what happened to you and your people and what continues to happen? But secondarily, and now, how do we honor your ancestral wisdom to heal ancestral and contemporary wounds, right? So we talk about those generational patterns that get passed down so that you may go from surviving to thriving in this life. Just think about what it would be like if you go into a therapy session and your therapist asks you that question. I would feel seen and heard in a way that I certainly wouldn't if someone said, you know, what's going on, what happened, right? So this just sort of broadens it out and also talks about the importance of empowering people to live a full and rich life in spite of what has taken place and the harms that have been inflicted. And so I'll just close now with a few resources. I always like to talk about what's challenging, ways of helping, and then how does this show up in our day-to-day lives. So these are just a few resources that are available. You may know about many of these. If not, then here's an introduction. So there are some great services, especially now that things are virtual. If people have never heard of Therapy for Black Girls, it's a wonderful resource full of information about wellness, psychological resilience, and taking care of oneself. And in addition to all of the resources available for that, there's also a directory. So if people are looking for clinicians that are centered on offering services to Black women and girls, there's an opportunity to find therapists that are in your local area. The Black Girl Doctor is another resource of clinicians that are specifically available to Black women. And then this is another resource. This is also local. So this is Safe Black Space, and they offer monthly healing circles specifically for people of African ancestry. So as the name says, it's a safe space for Black people to talk about and learn skills to cope with race-based trauma. So those are a few services that are available. And then these are just apps that are designed specifically for people of color. Liberate is the first one. That is a meditation app designed for people of color, by people of color. It has all kinds of meditation, so that's a wonderful resource. The Shine app is also another meditation app designed for women of color, and so is Exhale. So these are some resources that are available. And then I just learned about this one today, so I slid this in at the very end. So Black Enterprise is hosting a health and wellness summit on March 25th. So there's still time to register. And at the bottom it says, never have the realities of racial healthcare disparities been more apparent. It will address the physical and mental health needs of Black communities. So here's another opportunity to tap into some resources. And then these are some services that I offer. I host a monthly mindfulness and meditation group for African American women. It's called Melanin Meets Mindfulness. We meet the first Saturday of every month from 10 to 11:30. It's on Zoom, so if people are interested, then you're more than welcome to join. And then Holding Space is a nonprofit that I've recently formed, which when it launches, it will be a place for people to come to get various holistic services related to healing race-based trauma. So that is the conclusion of my presentation. If you'd like to stay connected with me, this is how you can find me. My website, drshakondarogers.com, melaninmeetsmindfulness.com, and then on social media at Melanin Meets Mindfulness. Okay, thank you so much.
Thank you so much, Dr. Rogers. That was really great. I know I definitely would love to participate in the Melanin Meets Mindfulness for sure. And also thank you so much for the Nakia Phoenix poem in the beginning. I absolutely agree. That was a totally great way to start because like you said, it is a very daunting topic.
Yeah.
Next, we are going to hear from Asantewaa Boykin, an emergency RN and a founding member of the Capital City Black Nurses Association and co-founder of the Anti-Police Terror Project, ATPT.
Thank you so much, Sadie. I appreciate this space to talk about a subject that is very close to my heart, and I get a lot of time to contemplate it. Right. As said previously, my name is Asantewaa. I am the daughter of Valerie Boykin and the granddaughter of Bertha Brandy. I became a nurse because my mother was a in-home care provider and her mother was a domestic worker. And I like to think that my getting my RN was an accumulation of the things they couldn't do because they were too busy raising us. I started my healthcare career as a CNA, later got my LVN, did some traveling at SPUD, later got my RN, spending most of my career working in mental health, and most recently transferring into an emergency department, which has been interesting because it seems our emergency departments have become a catch-all, right, for all of these public health crises that are happening at once, especially recently with homelessness, COVID, right? And then those chronic diseases that exist in our communities, specifically, and the lack of education around those. While studying for my RN, I became acutely aware and almost have become accustomed to being the only Black person on my side of the nurses station. Also, while studying, I also was actively engaged in activism, fighting for police accountability on our way to abolishing the police. Family stuff going on in the background. One thing that I think Black women specifically know is that this healthcare system and the way that it exists was made by and for white men, right? In fact, non-white men, right, and some women weren't considered human even, right? Despite the advances that our bodies made for our current healthcare system, even if those advances were made in a way that was not consensual, right? So given this particular paradigm, I often ask myself as a nurse, right? And then also as an activist, what can I do, right? How does my particular experience fit in the healthcare system? And also how does my particular experience fit inside of activism? How can I best advocate for my patients? And I believe that the answers to that are not simple, right? Because as a Black woman, right, inside of mostly white healthcare systems, I don't know about anyone else, but there's this feeling of, oh, can't be too loud, don't want to call that racism out, right? I've seen several instances where sisters who've been braver than I, right, have also suffered the consequences of that bravery. And I don't think I have to say that directly. I think folks understand what I'm getting at when I say that. But I think that there are ways that we, as healthcare professionals, as folks who are inside of these systems, can do, whether those things are safe or unsafe. You know, I've personally gotten to a point where safety is not a thing. You know what I mean, for me anymore. But safety as far as like job security, right? Like my physical safety. But I'm finding it more and more important that my activism belongs in our healthcare system, right? And that's just me and my personal journey. But I find that there are some things that we can do as healthcare professionals. We can be intentionally decolonizing our own practices. And for me, that started with understanding my own biases. There is something about drunk white men, and especially when they're acting entitled, that I have to take a deep breath and say, I am a nurse, this is my patient, I mustn't have to treat their symptoms, right? And while we are doing that, right, encourage and be an example to our colleagues on how to do that as well, right? We can also advocate on the policy level. There are ways that I've been able to identify, cooperate, conspire with other folks that exist in these systems who are of a like mind, right? So we can organize, right? We can organize to abolish some of the policies that exist, that are racist, that we know are racist, right? Most of all, I think that it's time that we come to the understanding that if we want systems that affirm us and that reflect us, that we're going to have to start creating our own. And not just creating our own, but legitimizing the systems that exist inside of our communities already, right? One of the ways that my organization, APTP, has done that was by creating Mental Health First. It's a non-police mental health crisis response system. Because our work is steeped in eradicating police terror in all of its forms, we began to notice a pattern that a large amount of folks who are harmed by the police, and an insanely large amount of Black women are harmed, are murdered, are brutalized by the police because they are in the midst of a mental health crisis, right? So because we noticed this pattern, we created this program, and the point is to minimize police contact. We know that in communities of color, the last thing someone wants to do is to call the police, especially on their loved one who is sick, right? The other side of that coin is we usually wait until we don't have a choice, right? So APTP's goal is to offer a choice. We just started this program last year in 2020, which we kind of pat ourselves on the back on because, you know, the endeavor was brave onto itself, but then to do it in the midst of a pandemic and uprisings and overt co-optation by state and national entities, just a little shade. It was extremely trying, but we've done it. We've not only done it, we've replicated another program in Oakland, California as well. So, and one thing that I learned from that experience is I think from birth even, we're told how hard, right, things are. And I don't want to make it seem like it was easy, but it was not undoable, obviously. So I would like to encourage folks, if there is some idea that you have that feels uncomfortable, that centers your community and the community around you, do it. Just do it, right? We know that it's going to take generations for us to regain the connection that we have to our traditional practices, as it's taken generations for us to lose those connections. It may also take generations for us to see these systems that we engage in to actually reflect us, not only our values, but also our skin tone, right? It also may take generations for us to build any kind of trust with these systems that we know have historically harmed us. Earlier, I mentioned my mother. I also mentioned my grandmother, and I mentioned them intentionally. For me, it's important to remember that I am not on this journey alone, right? That someone went ahead of me and like got the rocks out the soil and picked the weeds, right? So that I would have the room to plant roses, right? And it reminds me that the fight is not just in this moment, that the progress is not just for the immediate gratification or the pats on the back or the thank yous or the, oh, you're great, but it really is so that when our family members, when our friends, when our community members, when our sisters, when our children are coming down that same exact road, maybe my son won't have to plant anything at all and he'll just be going for a stroll, right? And that is what keeps me going, right? Despite all of the microaggressions and the uphill battles and the returning to conversations and being asked to hold the diversity and inclusion like conversation. The thought of my son just taking a stroll really does keep me going. And I would just like to encourage folks, especially the Black women in this space, specifically the Black women who work in healthcare, right? And who engage in this healthcare system, be creative, take the time, because we're socialized to believe that we have to be busy. We always got to be doing something. We always have to like do our best and do more and do it harder, right? And part of pushing back against these white male patriarchal systems is dismantling those own narratives in our heads, right? So rest, write, paint, be creative, drink water, do what makes you happy. And I thank you for the space. If you'd like to know more about Mental Health First, you can find us on aptpsac.com. I'm out of time, thank you. aptp.org. We are open for service Friday, Saturday, and Sunday in Sacramento. Our telephone number is 916-670-4062. In Oakland, same hours. The phone number is 510-999-9MH First. And we are APTP Oak and MH First Oak, and then APTP SAC and MH First SAC across all social media platforms. We will be here if you need us.
Thank you so much. I'm sorry if my little cough made you think that I was signaling anything. I wasn't. Yeah,
all good. Thank you so much.
And thank you for like, I can't even say how inspiring it is that within your work and in your career, you acknowledged all these like problematic issues and then noticed that the only way to address it is to create our own systems, and then actually went and did that with Mental Health First is just like so inspiring and incredible. Thank you so much for all the work that you do. It's really great. Yeah, so next we are going to hear from our last speaker, our last presenter, Adia Gipson. Adia Gipson, excuse me for mispronouncing. Adia is the health ambassador with Kaiser Permanente and a co-founder of Golden Journey Empowerment.
All right, thank you so much. I'm gonna click on here and share my screen right quick. Bear with me. Let's see here. Okay. All righty. Can you all see that?
No.
Okay, one second here. Okay. Okay, here we go. I just learned how to share screens today, so I'm learning right now. Let me know when you guys can't see the screen. Okay, 1 second here. Okay. Okay, still no screen. You guys can't see yet?
No, ma'am.
Okay, let me do this again. Okay. Here we go. All right. Now I'm getting it. Okay.
There we go.
Okay. All right, here we go. Let me start from the beginning. Okay. All right. Okay. Believe it or not, as long as we've been doing Zoom, this is my first time sharing a screen. Okay, so thank you for having me. My name is Adia Gipson. I am an IBCLC, which is an International Board Certified Lactation Consultant. I currently work for Kaiser Permanente, basically as a health educator to teaching and working with women with lactation. I am also the co-founder of Golden Journey Empowerment, and that's basically a support group for Black women and who need resources and assistance with breastfeeding. And so my topic this evening is discrimination in breastfeeding and healthcare among Black women. So we're going to get started with that. And so before I start, I really like this. Why is this picture? Oops, sorry. I was really liking this picture here. It basically shows a mother, pregnant mom, sitting in the waiting room at a hospital. You could tell there's like a medical provider in the back. She's pregnant. You could tell she feels stressed. She's probably all alone, isolated, depressed maybe. And so there's a quote that go along that I put along with this photo, and it says, "It's racism, not race, that affects Black women's health." And this quote is by Dr. Kiara King. She's an OBGYN. So my next slide here, it says Black breastfeeding mothers and healthcare disparities. These are things we're going to talk about this evening. What's happening and why? And what are some of the solutions to this? Before we get into it, the disparities of it, let's talk about why we are pushing breastfeeding the way we are and, really trying to encourage Black moms to breastfeed. So we want to talk about, what is it with breastfeeding? Why is it so important? And I have a picture here that just shows in just one drop, breast milk plays an important role in a baby's development. It's both food and medicine. So we really want to educate our moms on why breast milk is so important. And the composition of breast milk changes as your baby grows. And so I listed here on the photo just some of the life-giving components in breast milk that you can see right here, which includes hormone and growth factors, good bacteria, antibacterial and antiviral enzymes, vitamins and minerals, just to name a few here. The next photo we have, it's talking about colostrum, which I'm sure many of you heard is liquid gold. And so I really try to stress this with moms, how important their milk is, and really, really push liquid gold, which is their colostrum, because many times after moms give birth in a hospital, the first thing they say is, "I don't have any milk. All I have are these drops. That's not enough to feed my baby. I need formula." And you really want to educate moms on what is so important about colostrum. Yes, it's produced in very small amounts, but it's just enough for your baby's small tummy. And it's the perfect food for newborns. It's rich in carbohydrates, protein, and antibodies. And so your colostrum is nature's liquid gold. This is baby's first milk after delivery when they suckle, on mom's breast. Colostrum is concentrated food that comes in small amounts. And so babies naturally will need to nurse often because of this. And so it's really important to let moms know that, because sometimes when baby is first born, they think they don't have enough milk because baby is wanting to eat over and over and over again. So it's really important to educate moms about colostrum. And then we also want to talk about the benefits of breastfeeding for baby. You know, you want to let moms know this. There's a reduced risk of ear infections, sudden infant death syndrome, which is SIDS, obesity, asthma, and complications from preterm birth, like respiratory infections, necrotizing enterocolitis, just to name a few. And then what about mom? You know, we want moms to know, hey, it's not only benefits for baby, but it's also benefits for you too if you breastfeed. Those reduced risks are developing, you know, so a reduced risk of developing type 2 diabetes, rheumatoid arthritis, cardiovascular diseases, and ovarian and breast cancers. The American Academy of Pediatrics, which is the AAP, states breastfeeding is a natural and beneficial source of nutrition and provides the healthiest start for an infant. They recommend that babies are breastfed exclusively for the first 6 months of life and continue breastfeeding with complementary foods throughout at least the first year. So the question is, and the thing to know is, unfortunately, this recommendation is not being met by many moms, many Black moms. And we want to know, why is this? I wanted to show here some statistic facts about breastfeeding objectives and disparities. And this chart right here, it shows babies that were born at 2003 through 2006, and also babies born in 2013. And it just kind of shows the numbers here, why there are disparities. If you look at babies born in 2013, white babies who ever breastfed was at 84%, and Black babies was only at 66%. So that's a huge discrepancy right there in the numbers. And so we want to know, just to let you know, in the US, Black women have the lowest initiation and continuation breastfeeding rates in comparison to other racial and ethnic groups. Due to this, Black women and children disproportionately miss out on critical breastfeeding benefits. What has led to the decline of Black women breastfeeding their babies? Lower breastfeeding rates among Black women mainly reflects historic and systemic inequities. So our next slide here. I really like these photos here because it shows Black women, you know, proudly breastfeeding their babies, and they've been doing this since the beginning of time. This is how mothers bonded and provided nourishment, you know, to their babies. Breastfeeding wasn't awkward or weird, but it was actually a normal part of life. This was usually done up to around like 2 to 6 years of age. And so when you look at these photos here, you can see moms proudly breastfeeding in the public, open, whenever the baby wants, on demand. You don't see women in these photos in fear of what people are gonna think of them feeding their babies naturally. And so breastfeeding was a natural part of life, you know, like I said, between a mother and a baby. So now we're gonna take a look at history in order to understand why we are where we are today with attitudes regarding breastfeeding. This slide here shows women that were in slavery that were being used as wet nurses. And so you see the Black mothers here holding the white babies that they were, you know, forced to feed over their own babies if they had any. And so these pictures here really, it really shows a lot, and it says a lot here. When an African woman was sold into slavery, she no longer had any rights to being a mom. She didn't have any rights over her own body. Her breastfeeding decisions were snatched away from her. This was basically left in the hands of her slave master. She was forced to have baby, you know, she was raped and forced to have babies whenever they wanted her to, because that was more money for the slave owner. She was now forced to breastfeed the master's baby as a wet nurse during those times. The breastfeeding experience became redefined by slavery. Being forced into wet nursing in order to nourish the master's child while knowing your own baby needed your milk was undoubtedly unimaginable. Your body was no longer yours, and the decision to feed your own baby on demand was basically taken away from you. There were some slave traders that would even kidnap the slave mother's baby and then force her to wet nurse the white babies, because they would know that that mom was in a lot of pain from engorgement of not having her own baby to nurse now. And so that forced her into having to nurse another baby. If she refused, that mother was beaten and milked like a cow to feed the white baby. For those slave moms who did still have their own baby, many of them died during this time because the slave mother was forced to figure out another way to feed her own child. She usually resorted to a concoction of dirty water and cow's milk. When slavery had ended, the damage was basically already done in changing the views on breastfeeding for the Black woman. Babies still had to spend countless hours away from their mothers, because now mother and father, they still had to go out and find work and care for the family. So these babies were often left and cared for by older family members. Breastfeeding during these situations were not really an option. Unsafe feeding practices were done and breast milk substitutes were given to babies. This further caused an increase in the Black infant mortality. Let's fast forward to today. Research studies have shown that, many hospitals that are in the larger Black populations are far less likely to provide support in initiating breastfeeding after delivery and in outpatient settings. Black babies are most often given formula without first providing education on the benefits of breastfeeding and safe formula preparation, which is very important. Black mothers deserve to have all the information on both breast milk and formula, because you want to allow the mom to be able to make an informed decision on how she wants to feed her baby. If a mother says, hey, look, thank you for the information about breastfeeding, breast milk, but you know what, that's just not something I want to do, we have to respect the mom's decision if she wants to formula feed her baby. But the key thing is educate her on how to safely prepare formula. That's really, like I said, it's really, really important, because I ran across a lot of young moms who had no idea that there is a certain way to, safely prepare formula. And in the end, those babies can suffer detrimental consequences if the formula is not prepared safely. Another reason why many Black mothers are not wanting to breastfeed their babies is because many of the echoes from wet nursing are still resonating today. This information of breastfeeding, the information of breastfeeding being demeaning has been passed down for generations now. So we want to look at what are some of the barriers to successful breastfeeding for Black women. And some of those barriers include the lack of breastfeeding education from physicians, nurses, and healthcare workers. There's a lack of Black breastfeeding role models. You don't really see a lot of Black people, breastfeeding. If you were to go on the internet and click up breastfeeding, the majority of the pictures that you're going to see are white women breastfeeding. You're going to have to actually go in and search for Black mothers breastfeeding. There's a lack of family, peer, and social support and approval. And having to return to work soon after delivery and before milk production and breastfeeding is really established. So those are serious barriers there. Healthcare providers, they should be asking moms about their feeding choices early during a mother's pregnancy, not after she has the baby. This is something that moms should be taught as soon as they start going in for their prenatal appointments. Let's talk about your feeding choice for your baby. Breastfeeding benefits should be provided, and allow moms to ask questions and voice any concerns they may have about breastfeeding. This way, when the time comes for them to have their baby, you know, moms are equipped with knowledge about breastfeeding. Black infant mortality rates are more than double to that of white infants. Some of this is due to premature births, low birth weight, and birth complications. And a lot of that stems from the racism and bias and stress levels that moms are dealing with, you know, being pregnant. All of that plays a role in them delivering early. Preeclampsia, high blood pressure, things like that all contribute to birth complications for a Black woman. This is why breastfeeding education and support is so critical when a mother delivers early and baby is placed in the neonatal intensive care unit, which is the NICU. The significant health benefits that breast milk provides is crucial. Whether it be the mom's own milk, like her own breast milk, or human donor milk, it's extremely important for NICU babies to receive it. Unfortunately, there are many Black moms that are not aware of this, and so they resort to only allowing formula to be given to their baby. Premature babies are at risk for developing certain infections, like I mentioned earlier, the necrotizing enterocolitis. That's a hard word for me to pronounce. That is basically a serious intestinal disease, and breast milk plays a vital role in preventing that and other infections with premature babies. This is a quote here from Kimberly Seals Allers. She's a maternal and birth strategist, and so I really love her a lot. And she wrote the book, The Big Letdown, and it talks about big business corporation and breastfeeding. At the root of what's happening to Black women and their birth outcomes, as well as their disparities of breastfeeding, is an issue about racism and bias. So after talking about that, we want to know, okay, so what support systems are in the Sacramento area to help moms with breastfeeding or with resources? So one of them includes my organization, which is Golden Journey Empowerment. We have another one that's Nourishing Justly, and that's run by Kavisa Wood. The Sacramento Breastfeeding Coalition is another resource. And then we have the Black Infant Health Sacramento. And so these are just to name a few of resources in the Sacramento area for Black mothers to be able to reach out to and get support and help. So solutions. Black mothers need support. That's the main thing. They need support, education, encouragement when it comes to breastfeeding and knowing how to advocate for their health. We need more Black lactation consultants, Black peer counselors, you know, all the support, because it's very important for a Black mother to see another Black support person, because, you know, many of us are so distrusting of the healthcare system and nurses and doctors that don't look like them. And so it's really important that we try to, you know, get more Black healthcare workers, you know, lactation workers involved to be able to help increase the numbers of Black women breastfeeding. So we need more visual images of Black women breastfeeding their babies. And so it's important for us to destigmatize the practice of Black breastfeeding mothers. And so that is my PowerPoint for this evening. And I thank you guys for listening to me. Thank you so much.
Thank you so much. It's very insightful and very important that we had a lactation expert come in and speak about this, because at the beginning of life, you know, if we're going to face discrimination forever, it's important to address it as infants. And so although it is 7 o'clock, I do think it would be important to squeeze in just really quickly a couple questions, because there are some really good ones added to the chat. I was thinking maybe we have time for just two. The first one, I think, would be best directed at Asantewaa, just because ATPT does so much as an activist organization. And the question is, sometimes non-Black activists and or people of good intention come across as insensitive in their interactions with the Black community and the issues they face. What advice do you have?
I find that identifying allies, right, to have those conversations with those folks is like the best thing to do, right? And not in a way that's like shameful or like disempowering, but real talk, I don't have the room, not my work. And it may not be a popular statement, but we are all like suffering under this white supremacist patriarchal system. And for some white folks, it shows up with being intrusive and not like, you know what I mean? And having poor boundaries around certain issues. And we're gonna have to get free together, but we just gotta figure out how to have those conversations that allows folks to maintain their humanity and actually build trust and not dismantle it. So find your allies, have those folks go have those conversations and keep your peace.
Thank you. I think that's great advice. I totally agree that I can imagine that sometimes allies are afraid to speak up because they don't want to, just be canceled or the shame. And so having those conversations, I agree, is a great way. So this last question, I kind of want to leave it open to whoever wants to answer it because I'm sure all three of you have great insight. And the question is, how do we encourage our Black students and teenagers to speak up and never feel afraid? It's a hard question, but what do you guys think? Just whoever would like to give some advice.
Well, I'll jump in with just a comment, particularly around that last part about never feeling afraid. I think because we live in a system dominated by white supremacy, fear is very real, right? And so I think it's really important for people to validate the fear, the anxiety, the uncertainty about, the state of our society. However, I don't think that we should let fear dictate our actions and how we show up. So the thing I tell my clients, the thing I say to myself, the things I say to my little ones, I have two little Black boys who are precious and beautiful. The thing that we have to do is feel the fear and do what's necessary anyway. So I think it's about holding both, not necessarily about pushing one to the side so that you can do the other, right? Because the fear is very real and we can't escape that, right? As we were talking about before, that we're all trying to get free, this is going to be a messy process. It is a messy process, right? And it's going to bring about a lot of uncomfortable feelings, and we have to figure out how to navigate our way through those. And there's going to be a lot of emotion that comes with that, right? So I think it's about holding one and doing the other. So that's my 2 cents on that.
Thank you. I love that so much. To have the courage to speak up is to embrace the fear and just like embrace it. Yeah, I love it. Unfortunately, I don't know if Asantewaa or Adia, if you guys want to add anything or okay. So yeah, so unfortunately we are at the end, and so to continue this conversation and conversations similar, please consider joining our UN Women Committee. Our committee aims to raise awareness about gender equality and empowering women and girls in the greater Sacramento area. We achieve our work through partnerships and collaborations with our women empowerment organizations and professionals in order to provide them as a platform to share their crucial work with the community, as well as engage in other community actions to uplift women. Please, anyone is welcome to join the committee. Please consider joining or becoming a member of UNA Sacramento. You can join by going to unasacramento.org/join. Both of these links will be sent in a follow-up email to everyone who received the Zoom link. And so yeah, with that being said, I would just like to thank everyone who came tonight. Thank you to our sponsors, and thank you to our presenters. It's a very daunting and disheartening topic and issue, so I thank you everyone for participating in these hard conversations. And again, I just want to thank everyone for participating. This was a great conversation.
Thank you.
And yeah, I really hope that we can continue this conversation and many more in our UN Women Committee, as well as just as UNA Sacramento in general. So again, thank you. Have a good night, everybody.
Thanks for creating the space.
Thank you very much.
Yes, thank you.
Yes.
Thank you.
Thank you, everybody. Thank you, ladies, for your great talks.